Good morning. Good morning. Welcome. Thank you for being here. Thank you for your time and your concern and interest on this issue. Today we have our elected officials as well as appointed department heads of agencies that are going to talk about where we've been over the past 48 hours, where we're currently at now, and where we plan to go in terms of preparedness. A couple ground rules for the media as we get started. Each speaker, once they come up, they will say their name, and they'll go ahead and spell it for you as well so that you can get that down for your records. Please hold all questions until the end. Once all officials have made their comments, then you can ask questions at that point. At that point, that official will step back up to the podium. If you'll call specifically out to the official that you would like to ask the question to, they'll step back up to the podium and they'll address your question at that time. So with that, I'll introduce Mayor Jack Draper.
Jack Draper, Mayor of the City of Anniston, D-R-A-P-E-R. Just as you know, the city received an email at noon on Saturday informing us that it had been decided by the Department of Health and Human Services and the Federal Emergency Management Agency to transport patients who had been diagnosed with the coronavirus from the cruise ship, the Diamond Princess, in Japan. None of us at the city, the county, or any of the people who you see up here today had any really advanced knowledge of this. So when we received the email, we began immediately communicating among ourselves. And I really want to thank everyone who is standing here and others for the work that was done collaboratively to work with our federal partners. We had folks directly speak to the president, and I'll let them speak more about that themselves, to senior officials at the Department of Health and Human Services. But ultimately, it was determined, I believe, based on a series of meetings that we had with each other and with senior officials at the Department of Health and Human Services, that we're simply not prepared to help our fellow citizens at this time who have been diagnosed with this disease. It became apparent to us upon meeting with officials from Health and Human Services that, from our perception, there was no real plan, and we had no idea, quite frankly, what would be expected of us as a local community, as a community of law enforcement, first responders, and local healthcare providers. So I think it was important that we help develop information, but we also disseminated information to Health and Human Services, and it's my understanding that some of that information was ultimately given to the president. Again, I'll let those folks talk about their conversations with President Trump. But where we stand now, we received an email from one of the Health and Human Services senior officials with whom we met yesterday, informing us that at this time the CDP is no longer going to be a site where coronavirus patients will be transported. And so that's where we stand as of now. Thank you.
Good afternoon. Good morning. My name is Tim Hodges. I'm the chairman of the Calhoun County Commission. That's Hodges. Jack's kind of summarized in the last few days. I think everybody's heard kind of where we are and what's been done. And, you know, I'd like to just take a minute to thank a lot of the people that have been involved, the ones behind me and the ones that are out here, Gloria and Mark, all the different people, the city of Anniston, Mike's office, Dale's office, the governor's office. One good thing about all this is the community has really come together. I've had over 100 phone calls and texts, and it's just really good to see the community pull together like this. Every city has done a resolution in support of trying to stop this, or at least delay it until we're better prepared, give everybody a chance to get what we need to be able to do this. But having stopped it is the best plan. But there's a lot of people that have worked behind the scenes besides the ones that are sitting up here, and from Richard Shelby on down. So I just want to take the opportunity to tell everybody how much we appreciate everybody helping and the communication and how well everybody's worked together. And I think it says a lot about our community. And I'll let the rest of them give you some more details on where we are. Thank you.
I'm Del Marsh, State Senator, M-A-R-S-H. One thing I do want to make very clear today, and that is the importance of people working together. Because there's no doubt in my mind, had this group behind me not gotten together through many conversations yesterday and getting the attention, getting people to listen to us, this would be happening. These people would be coming here. There's no doubt in my mind. So I think it's very important to understand that it's important to communicate as we have. It's going to be important to continue to communicate. And I think it's very important we continue. I want to thank Governor Ivey, Congressman Hodges, who's here today, Senator Shelby, and the President of the United States, who all ultimately literally listened to what we were trying to tell them, and that is we have a training facility. We don't have a treating facility at this time. We don't. And we want to help, but it would have not been the right thing to do. I'm convinced of that. And so I think we all better stay very focused on this situation and continue to have these discussions because we were at risk. Thank you.
My name is Mike Rogers. I'm the Congressman from the 3rd Congressional District of Alabama. And I want to thank the community leaders here for taking such decisive action in such a quick fashion. I learned about this on Saturday morning when I was driving to Atlanta to attend a wedding of a staff member. And was informed by the governor's office, and they informed me that HHS had contacted them on Friday night to inform them they were bringing these infected individuals to the Center for Domestic Preparedness. Didn't ask, just informed them. Didn't ask the local leaders, didn't make sure that the local hospital was prepared. It was really poorly handled. My staff began to work with Senator Shelby's staff to see if they could handle it on their own and ran into obstruction. So I just called the president on Saturday afternoon. He was on Air Force One on the way to India. He was completely unaware of this. He was annoyed that these individuals had even been brought back to the continental United States while they were still infected, but assured me that he would get to work on trying to stop it. I had a phone call from some HHS officials about an hour later trying to calm my concerns and let me know there was nobody going to be at risk, and they were unsuccessful. The thing that I want people to be mindful of is the Center for Domestic Preparedness is a world-class training facility, but it is in no way prepared or equipped to deal with infectious diseases. These individuals are going to be housed in barracks out there near individuals who are brought in to train. There were 300 new trainees brought in this morning that would be training for a week to 2 weeks at that facility and then going back to their respective communities throughout our nation. This is an airborne contagion. Nobody could assure us that these individuals were not going to be contaminated before they went back to their respective communities. So in my view, it was not only that we were ill-prepared, it was a boneheaded decision to bring them to a facility that's going to have individuals going back throughout our nation who could be contaminated. Yesterday morning, the president called me back to tell me that he was still working on it, but he had been informed that I was the only person opposed to it. Everybody else was fine with it. And I assured him that was not accurate. I'd been on a conference call. Michael Barton, the EMA director here, did a great job of keeping everybody organized. I was able to tell the president that I'd been on a conference call with all of our local leaders, all of whom were concerned about this and opposed to it unless we had some better equipping in our community. And he assured me that he would get back with me. So I received a phone call from Secretary Azar at 2 o'clock yesterday, informing me that the president had directed him not to bring the individuals here and look for other alternatives. And then the president called me about 3 minutes later to let me know that they would not be coming here. I can't overstate how much I appreciate President Trump jumping on this. He's a very busy man. He was on his way to India. He has a lot of things to do, but he stopped and took care of us. I want you to know we are all patriotic Americans. We want these individuals who are contaminated with this virus to be treated like we'd want to be treated. And that's not to be brought to a facility that's not prepared to take care of them, not to be carried to a hospital that's able to take care of them. So hopefully we're going to have some serious dialogue when we get back to D.C. about excess capacity. We were informed yesterday when I met with our local leaders and HHS officials that there are 5 states that currently house these individuals. They are prepared to deal with infectious diseases. And if we need excess capacity, then we need to work on getting that. And that may be at some place like Center for Domestic Preparedness, but they need to equip us for it and prepare the community for it if they're going to bring these individuals in the future. But at this point, there will be no individuals contaminated with the coronavirus intentionally brought by the government to Calhoun County.